Everyone, I am Taiwa Bilaje by name, and I'll be taking you through the course overview of NSC 513. Basically, this slide entails the introduction to Earth economics. What are the objectives of this course? By the end of this course, you should be able to understand the basic principles of Earth economics. You'll be able to analyze how economic factors influence healthcare delivery. You should be able to describe Earth financing and major options in healthcare financing. And also, you should be able to apply Earth economic principles to nursing practice and in decision making. Why study of Earth economics? How is Earth economics related to nursing? What is the importance of this Earth economics to nursing? Nurses play a crucial role in delivery of healthcare and also in managing of healthcare resources. Understanding Earth economics helps nurses to manage healthcare resources efficiently, ensuring that patients receive optimal care within budget constraints. Also, by understanding the economic factors that influence healthcare, nurses can contribute to strategies that improve patient outcome and also reduce the healthcare cost. Also, understanding economics enable nurses to design effective and efficient healthcare delivery system. Understanding economics also enable nurses to contribute to cost effectiveness by ensuring efficient use of healthcare resources. Key concepts in health economics: supply and demand. Supply simply means the quantity of goods or services that the firm offer for sale at each possible price, while demand means the quantity of product that consumer will purchase at each possible price. Simply put, healthcare supply and demand means how healthcare services are supplied and the demand for them by patients. Opportunity cost is the trade-off involved in choosing one healthcare intervention over another. Or we can say the value of the second best choice that is given up when the first choice is made. The marginal analysis is the additional cost or benefit of a healthcare intervention or decision to the health system and financing. We have different healthcare systems, which includes the public funded system, the private healthcare system, and the mixed system. The private healthcare system entails whereby the government finance healthcare through taxation. Example is NHS. National Health Services in UK, and also Medicare in Australia. The private healthcare system, that is privately funded healthcare, whereby finances of healthcare are funded by private entities, e.g. as an individual or private insurance company. Patients often pay out of pocket or through private insurance plans, and this kind of system is prominent in US. We have a mixed system, which is the combination of both public and private. Government provides basic healthcare services, while the private entities offer additional services. This kind of system is prominent in Canada and Germany. So the way of financing mechanisms, which have been mentioned earlier: general taxation, that is healthcare is funded through taxes collected by the government. This method means that healthcare services are available to all citizens, often at no direct cost at the point of use. So when funds for healthcare are generated through taxes that are collected by government, and health insurance too is a type of insurance in which the insurer will pay the medical cost of the insured if the insured is sick. So out of pocket, this entails that the patient pay directly for the services being rendered at the point of receiving them. This method is common in countries without universal healthcare coverage or services not covered by insurance. We can say example is Nigeria. Economic evaluation in healthcare, or the economic evaluation helps in decision making regarding the allocation of resources. So we use cost effectiveness analysis to evaluate healthcare. That is comparing the relative cost and outcomes of different courses of action. You have cost utility analysis. It takes into account the quantity and quality of life produced by healthcare interventions. The cost-benefit analysis, that is, measures both cost and benefit in monetary terms. The rising cost of healthcare. What are those things that led to the rise in the cost of healthcare? This includes the heavy disease burden. These diseases are largely attributed to this poverty, infectious disease, and parasitic disease, which imposes increase in economic cost on individual, households, and society at large. Also, technological changes, that is, the invention of new technologies, has also led to the increase in the cost of healthcare. Increasing cost of required input for healthcare also is one of the causes of the rising cost in healthcare. How can this be controlled? How can this cost be controlled? It can be controlled through the following measures: prevention and early intervention. Prevention, such as immunization, providing safe water, and giving education on sanitation, maintaining a good housing, and all of that can help to prevent or eradicate some diseases, and which lessen the disease burden in the community. Efficient resource utilization, like that is making use of the resources, healthcare resources that is within the facility efficiently, and policy changes to promote cost effectiveness. Health insurance. What is health insurance? Health insurance is a system in which the prospective consumer of care make payment to the third party in form of an insurance scheme, which is in the event of future illness will pay the provider of care for some or all of the expenses incurred. The type of health insurance we have includes the private insurance, that is individual employers we pay to the private companies, public insurance, that is government funded, community-based insurance, that is community financing, community support in most developing countries by providing resources, either financial and materials, for the improvement of health and sanitary infrastructure, e.g. provision of latrines, well, health facility. Economic burden of disease, direct costs. This is evaluated in monetary terms, which includes the cost of medication, laboratory investigations, and many others. Indirect cost is a type of cost resulting from reduced productivity because of illness. That is, an ill person would not be able to perform effectively at the place of work, thereby leading to reduced productivity. Intangible costs, they are not monetary terms, that is, they are non-financial outcomes of disease and medical care. They are not expressed in monetary value. This includes suffering, pain, grief that comes from the disease being battled. What are the role of nurses in health economics? Nurses are integral to allocate resources, that is ensuring optimal use of resources in healthcare delivery. Nurses also take part in advocating for policies that will improve the patient's access to affordable healthcare, as nurses often advocate for health policies that improve patients' care. Knowledge of health economics allows nurses to make informed arguments about the cost effectiveness and the benefits of different policies. Conclusion. Health economics is essential for nurses in today's complex healthcare system environment. It equips nurses with the tools to make informed decisions, advocate for patients, and contributes to healthcare policy development. It is expected of you to participate effectively in discussion, case study, and practical application of health economics to nursing. Thanks for listening.